Welcome back. I'm Dr. Adam Sewell, MD, and you're watching Module 3 of the Microplastics Toxicity Training, proudly certified by the Microplastics Health Alliance. In this module, we shift our focus inward. We're no longer just talking about environmental exposure. We're examining what happens once microplastics enter the human body, how they get in, how they're absorbed, where they accumulate, and how they interfere with human physiology at multiple levels, from cellular function to systemic inflammation. This is where the conversation becomes clinically actionable. For us as physicians, understanding these internal dynamics is critical because many of our patients are already exhibiting symptoms consistent with chronic microplastic toxicity, persistent low-grade inflammation, unexplained fatigue, gastrointestinal dysbiosis, hormonal imbalances, neurocognitive decline, and more. Let's ground this in data. In 2022, a Dutch research team published a landmark study in Environment International demonstrating microplastic polymers like polyethylene terephthalate, PET, polystyrene, PS, and polymethyl methacrylate, PMMA, circulating in human blood. Shortly after, Ragusa et al. Confirmed microplastics in human placental tissue, raising serious concerns about fetal exposure during critical developmental windows. A 2022 paper in Science of the Total Environment went further, identifying microplastic fibers in the deep lung parenchyma of surgical patients, proving that these particles are not just ingested but inhaled and retained. Even more concerning, microplastics serve as chemical delivery vehicles. They absorb and carry endocrine-disrupting chemicals like bisphenol A, BPA, phthalates, polycyclic aromatic hydrocarbons, PAHs, and even heavy metals. These compounds are independently linked to metabolic disorders, reproductive dysfunction, neurodevelopmental delays, and even carcinogenesis. In this module, we'll break things down into 3 core routes of entry: ingestion, dermal absorption. We'll then preview how these particles travel throughout the body and begin interfering with immune regulation, hormonal balance, and neurological integrity. Let's begin. Part 1. Ingestion, the gut. As the front line, ingestion is the most well-established route of microplastic entry. A 2019 study by Cox et al., published in Environmental Science and Technology, estimated that the average American ingests 39,000 to 52,000 particles per year from food and beverages alone. When inhalation is factored in, the total jumps to over 74,000 particles annually, and that's likely an underestimate. Let's get granular. Bottled water contains, on average, 325 microplastic particles per liter, according to Mason et al. 2018. Tap water, although somewhat cleaner, is still contaminated. Seafood, particularly shellfish like mussels and oysters, are known to bioaccumulate microplastics in their digestive tracts. Salt, especially unrefined sea salt, routinely tests positive for microplastic particles, and food stored or heated in plastic containers, especially polypropylene or polystyrene, releases additional microplastics and chemical plasticizers under heat or UV exposure. Once ingested, most particles pass through the gastrointestinal tract, but size and surface chemistry matter. Particles greater than 150 micrometers are typically excreted in feces, but smaller particles, particularly nanoplastics less than 1 micrometer, can cross the intestinal barrier. How? Where particles slip between enterocytes via tight junctions, especially when intestinal permeability is compromised, for example, leaky gut states. Transcellular endocytosis. Particles are taken into epithelial cells and translocated into the bloodstream or lymphatic system. M cell uptake via Peyer's patches, resulting in retention in mesenteric lymph nodes and triggering mucosal immune responses. Animal studies, Ding et al. 2017, Environmental Science and Technology, have confirmed the presence of microplastics in the liver, kidneys, and gastrointestinal tissue following oral exposure. Part 2. Inhalation, the airborne route. Inhalation is emerging as a significant yet often overlooked route. In 2022, Jenner et al. Published a study in Science of the Total Environment detecting microplastic fibers in deep lung biopsies of human subjects, specifically polyester and acrylic fibers. Common airborne sources include synthetic textiles, via laundry or daily wear, indoor dust, car tires, tire wear particles, paint flakes and building materials. Airborne microplastics have been measured at concentrations of 1 to 60 particles per cubic meter in indoor environments, Prada, 2018. Larger particles greater than 10 micrometers are typically trapped in the upper airway and cleared by mucociliary action. However, particles less than 2.5 micrometers, PM 2.5, can bypass these defenses and deposit in bronchioles and alveoli. Once deposited, they can provoke alveolar macrophage activation, cytokine release, and in chronic exposure contribute to pulmonary fibrosis. In murine models, long-term exposure led to oxidative stress and granuloma formation. Lim et al. 2021. For patients with pre-existing lung conditions such as COPD or asthma, the presence of persistent polymer particulates may exacerbate underlying inflammation. Part 3, dermal absorption, a developing concern. Let's move on to dermal absorption. Microplastics are widely used in personal care products, from exfoliants and facial scrubs to lotions and sunscreens. While the stratum corneum acts as a strong barrier, nanoplastics less than 100 nanometers have shown the ability to penetrate through hair follicles, sweat ducts, and damaged skin. A 2021 review in Frontiers in Toxicology noted that transdermal penetration is plausible, especially when combined with plasticizers like phthalates and surfactants that disrupt lipid bilayers. Animal studies have demonstrated the accumulation of nanoplastics in regional lymph nodes following topical application, particularly in settings of skin barrier dysfunction, such as eczema or psoriasis. Although human data is still limited, the cumulative risk in individuals with chronic skin exposure, such as workers in plastics manufacturing or cosmetology, warrants further investigation. Let's recap. Microplastics enter the body through ingestion, inhalation, and possibly dermal absorption. Once inside, nanoplastics evade traditional elimination pathways and begin interacting with cellular systems. Gastrointestinal, pulmonary, and cutaneous barriers are all vulnerable, especially in individuals with chronic inflammation or compromised epithelial integrity. In the next section, we'll track the biodistribution of these particles once they've entered systemic circulation, focusing on accumulation in lymph nodes, the liver, kidneys, brain, placenta, and beyond. And remember, if you're following along in the practitioner's toolkit, now is a good time to reference. Diagram A, translocation pathways of microplastics. Table B, polymer types and associated additives. Understanding the routes of entry is the first step toward recognizing systemic toxic burden, something we'll explore in depth in the next section on tissue accumulation and immune response.